Mom, we really need to get you to the doctor.
I'm fine, baby. There's nothing
I
wrong.
know you're fine, but just to be safe, okay?
If your parent is over 70, this video could save you years of frustration because most adult children make one mistake at doctor's appointments that causes their parent to stop listening, stop trusting them, and sometimes stop going to the doctor altogether. Can we be honest for a second? The hardest part of caregiving isn't the medications. It's not the appointments. It's really not even the diagnosis. It's convincing someone that changed your diapers that they need help. And here's the controversial thing that nobody wants to say. A lot of elderly parents aren't really stubborn. They're scared. And once you understand the difference, everything changes. If you're new here, I'm Erica, the neighborhood NP, and I own a company that specifically caters to families managing their elderly loved ones' care. I work in nephrology full-time, and today I'm going to teach you how to talk to doctors for your elderly parent without making your parent feel like you're taking over their life. Because after years with working with elderly patients and their families, I've learned something very important. Most family conflicts surrounding healthcare aren't even really about healthcare. It's about control. Here's something I need every caregiver to hear. When your 80-year-old mother refuses to go to the doctor, she's usually not being stubborn. She's protecting the last thing that belongs to her, and that's her independence. Think about it. They survived years without your help, raised families, worked careers, made decisions. Now all of a sudden everybody's asking, did you take your medicine? Should you still be driving? Can you still live alone? Maybe it's time we get you some live-in help. That is terrifying. Research shows resistance often comes in 4 forms: losing independence, becoming a burden, losing control, not trusting the people that are involved. So before you get frustrated, ask yourself, are they really resisting care? Or are they trying to protect their autonomy? Because those require 2 different conversations. Most caregivers prepare for doctor's visits completely wrong. They spend all their energy convincing their parent to go, then show up completely unprepared. Here's what you should actually do. Before the appointment, write down symptoms you noticed, medications you're concerned about, questions you want answered, changes in memory, mood, mobility, or appetite, and please, know their medications, know their allergies, know their major surgeries. You cannot advocate effectively if you don't know the facts. Actually, one of the smartest things you can do to prepare for a doctor's visit with your aging parent is to ask them, what do you want to talk about with the doctor today? Notice the emphasis. You, not me, not your children, not your spouse, but what is it that you want to talk about at the doctor's office today? Because the appointment is still about them, not you. This is the mistake I see every single week. The doctor walks in the room, and before mom can even speak, the adult child starts talking. Well, mom's been doing this. She forgot that. She won't take her medicines. She keeps falling. Just stop. Let your parent speak first. Always. Unless there's a major cognitive issue preventing them from doing so. Nothing shuts down trust faster than being treated like a child in front of another adult. If you remember only one thing from this video, remember this. Advocating for your parent does not mean speaking over them. It means making sure their voice gets heard. Now let's talk about the actual appointment, because many caregivers don't realize this. You're interviewing the doctor too. Pay attention. Does the doctor look at your parent? Or do they only look at you? Do they explain things clearly? Or do they hide behind medical jargon? Are they open to questions? Or do you feel as if you all are being rushed out of the door? Because one of the biggest reasons why older adults avoid doctor's appointments is due to poor communication. And if the doctor starts using language that no one understands, simply say this. Can you explain that in a way that we both can understand? That's not being rude. That's responsible. And that's advocating for yourself or your aging parent. This is the part that breaks most caregivers. Because eventually you'll hear, I'm fine, I don't need any help, leave me alone. Here's what not to do. Don't argue, don't lecture, don't force. Instead, try this. Mom, you've been taking care of yourself for 80 years. And honestly, you've done an incredible job. But even the strongest people need backup sometimes. Notice what happened there? You honored their strength first, then introduced support. People become defensive when they feel controlled. People become cooperative when they feel respected. That's true at 8 years old too, not just at 80. Here's the mindset shift that transformed the way I approach elder care. Most people think that accepting help means losing independence. It's actually the opposite. Accepting the right help often preserves independence. For example, grab bars help people stay in their homes. Medication management prevents hospitalization, and routine appointments help to prevent crisis. Home services help to prevent burnout. Refusing help doesn't always protect independence. Sometimes it accelerates dependence. And that's the conversation that families need to understand. The bottom line is you cannot force a mentally competent adult to accept healthcare, even when you're right, even when you're worried, even when you're absolutely terrified. But you can communicate better, prepare smarter, advocate more effectively, and create an environment where your parent feels respected instead of controlled. Because the goal isn't to take over their life. The goal is to help them live it as fully and safely as possible. If you're caring for an aging parent, drop a comment below and tell me, what's the hardest part of getting your parent to go to the doctor? I read every comment. And if you want more real-world guidance on everything caregiving, chronic disease, dementia, kidney disease, dialysis, and navigating the healthcare system, you're in the right place. I'm Erica. This is the Neighborhood NP, and until next time.